surgeon, urologist. And what I'm going to speak to you today is affordable healthcare model, which basically in a rural setup. And just to give you a brief insight about our group, we are from MP Birla Group, and present chairman of this group is Mr. Harshvardhan Lodha. We have chain of hospital belonging to our group, of which about 4 hospitals are in rural setup. We have MP Birla Hospital in Satna, we have cancer unit in Satna, and then one we are bringing up in Chittor. We have one hospital in near Calcutta, Birrapur, and then many other hospitals like Bombay Hospital, Bombay, then in Indore, Bombay Hospital, Brahmada Beta Eye Hospital in Calcutta, Bellevue Clinic in Calcutta, some of the other hospitals which belong to our group. About my hospital, it's a rural-based model catering to about 9 districts in and around, to the population of more than 3.5 crore. And we are there in that area for last 25 years, celebrating 25th year. Recently we got NABH accreditation, and it's very famous for surgical specialties, for other units like specialty like gynec, we have orthopedic, we have replacement procedures going on, and laparoscopic surgery, cancer surgery. Obviously it's spread on a very huge land, 32 acres of land. We have other units which are parallelly working is telemedicine department and IT enabled services. We have a very good community college where we are training underprivileged kids, and then transfusional sciences and blood bank. Apart from that, we have Institute of Life Sciences where modern genomics, genetics and bioinformatics is being carried out. Now our mission is to create a world-class facility at an affordable cost in a poor setup, poor rural model, and we want to become quality, leading quality care in research, education and training. Of course, patient satisfaction remains main thing, and then this is a team of about 41 doctors, and we have about 400 people as paramedical, nursing staff, administrative and security and housekeeping staff. There are a lot of specialities which we have, but namely just to mention few of them, I've just listed them, and we have a lot of workload from in and around patients, and nearly 9 districts we cater in the northeast portion of Madhya Pradesh, including 2 districts of Uttar Pradesh also. We see on an average about 50 to 55,000 patients every year, and indoor patients is also huge. There are facilities which are there for the patient's relatives, and general facilities for patient to have getting treatment in outpatient, and these are some of the views of hospital. And as you can see, the cancer care is on your upper right. We have the view of our new cancer care unit. World-class operation theater, modular theaters are there where we are operating on an average of 13,000 patients every year in all the departments. In surgical specialty, we are operating about 7,000 procedures every year. Laparoscopy, cancer surgery and other surgeries are regular on our. We see a lot of complex procedures being done by myself and with my team, and some of them went to world record, which I'm going to talk to you in a few slides after this. These are all various equipments. We have a great cancer unit which started in 2008. We have linear accelerator, and just to tell you that one of the cheapest treatment available in the world for radiotherapy on linear accelerator, latest world-class machine, is only 15,000 as against 2,80,000 for a patient who is being treated in big cities. So an outpatient department we charge 50 rupees. We started with 3 rupees 25 years ago. This is the, again, inside of our cancer unit and the inner accelerator. Then we created a research wing in which we have animal lab and recognized from Lucknow, from Food and Drug Controller of India, and all the facilities to induce cancer and to come out with a solution, whether it is from the allopathic science or from Ayurvedic science. We're trying to mix up both the sciences so as to bring down the cost to the lowest. We started Telemedicine Center way back in 2003, the first telemedicine center of North India. And at that time, I just want to remind all the people that we didn't have high data lines. At that time, we had just 2 ISDN lines, so it was very difficult. But yes, we could have video conferencing. We had cardiac telecardiology, telepathology, teleradiology, and of course consultations. Now with the new data 4G and high-speed data line, it is very easy for us to conduct all this. We created the first telemedicine unit at Khajuraho Airport within 3 hours with the ISDN line with our respected Chief Minister of Madhya Pradesh, then Shivraj Singh Ji. And we demonstrated live radiology and procedure to him at Khajuraho Airport. These are a few equipments on telemedicine which we use. Now this is the new thing which we have started, community college. All underprivileged students, those who are there, those who were child labor kids, those who are collecting garbage, and their earning per day was 2 to 3 rupees. Now they're being trained and being on to certification programs and from university and UGC recognized university, and they are having their livelihood and they are earning to the salary to the tune of 7,000 to 10,000. Some of the people are placed for 20,000 in big cities. So it is a very innovative program. We've trained about 2,800 students now. We have a very big aim to train about more than 1 lakh students over a period of 2 to 3 years. We have a residential facility for the female kids, and these are the kids, those who have a very intense program of training onto various sciences in various departments, communication skills, and it is wonderful to see these kids, the generation next, and doing so well. We've started the Institute of Life Sciences. We are trying to have a program of genomics with MedGenome, Genentech, USA, and other companies so as to bring biotechnology and bioinformatics along with genomic sequencing work to be done at Satna very soon. And MedGenome has kindly consented for the same, and their chairman Sam and Shekhar from Genentech both visited our institute along with the team of their medical director and the people. We have a lot of CSR work. We trained these kids, those who are underprivileged, and we give them a diploma and certification program in a very honorable way in a convocation ceremony which happens twice in a year. Now I have a few lines onto genomics and what we were earlier onto rural genomics and mapping. It's hardly anything which was done. Now there is a need for developing a good genetic lab in rural model, and as there is a big data available here. So I personally feel that a lot of patients of cancer and other hereditary tribal disorders which have to be mapped very well, and this new genomic science can play a very important role in a company like MedGenome, a company like Genentech, and other big companies can play a very important role. I personally feel that this science will be the science of future. We are promoting the scope of genomics all around in India so that people understand the importance. As you can see in this photograph, there are 3 generations of family somewhere in Vietnam. They look alike. So there is a need for understanding that there is a genomic correlation of that. And it is very important to see that. We had Professor Nagin Singh from ICR who had come along with Dr. Jitendra from Anand. So we're working on to some of the application of food and especially rice for treatment of diabetes in the population which is increasing. Doing a lot of CSR activity for upliftment of women and women empowerment, and as a group it is our responsibility to enhance the strength of women power. And we started transfusional sciences, which has components, which has apheresis, platelets, and uh, world-class facility for the rural model for in and around, which was not there. Now, I removed a tumor which was 66 kg, which went into world record. And as you can see that this was 66 kg tumor. She was 101 with tumor and 35 without tumor. And this lady went into our surgery procedure, went into world record. And these are achievements, and she was, after 7th year of follow-up, she was chief guest on 26th January, the flag hostage. We celebrate life not only just by treating, but by celebrating life itself is also a very important thing. Shekhar and Sam from Genentech and MedGenome were there with us. They saw our facility and quite impressed with this. And I'm really happy to say that we are working very closely with international partners, University of Illinois, and development of new equipment. And with Cornell, we are having a technical tie-up for 15 years. So we are on to advanced sciences along with the basic rural facility which we are trying to create and giving to most underprivileged people of that part of the India, Madhya Pradesh. Thank you very much for giving me this opportunity to talk to you in a short time. Thank you.
Yes, sir. Now we will take the questions.
Yeah.
First question from Vineet.
Yes, Vineet.
What steps have government taken in order to provide the facilities to poor and rural people?
No, it is very important that when we talk about rural healthcare, there is a need for a great support from either big organization or the industrial houses to come out and then make it a viable project, self-reliance project. So it takes I took about 5 to 7 years initially to establish that, and we had a great team of doctors, those who are working with us. So to create a team in peripheral model also is very difficult because most of the doctors wish to now settle down in big cities, but it was very challenging. And to create a cancer unit, to create a community college, it takes time. But yes, if you are focused on to creating a team, you can do it. That's what I can say to you. And then, of course, once we reach self-reliance, there's no problem. But with the volume, we can always do that. Yes. Any other question? Anyone?
Next question from Prerna.
Yeah.
What is the number of patients diagnosed with cancer, and what is the number of survivors? And this question is from
Pardon?
Hello. Yes, the question is from Satish.
Yeah.
What is the number of patients diagnosed with cancer, and what's the number of survivors?
Now see, the number of new cases which we register are 5 to 7 every day, and we divide them into 5-year survivor, 10-year survivor, 15 and 20 years. So after 15 years, we say that they are disease free. So we have different diseases and different cancers and different survivors. So we get a lot of head and neck cancer because tobacco chewing is very common in that part of North India, and alcohol is very common. So tobacco in all forms is done, whether it is taken as a pan parag or some kind of a chewer, or in the smoking form. So we do get a lot of head and neck cancer. We do get a lot of gallbladder cancers, and every cancer, I must tell Satish this, every cancer behaves differently. It is not like one gold standard. Gallbladder cancers, once they are diagnosed, they are very aggressive. They do badly. So 5-year survivor or 2 years or 3-year survivor is hardly about 10 to 15% in spite of best treatment, be it radical surgery, be it radio or chemotherapy. But oral cancers, they do well with 5 years to 10-year survival in stage 1 and 2, probably about 30% 5-year survival. And we get a lot of colonic cancers, breast cancers. Almost breast cancer 15-year survival is more than 50 to 60% if they are early. So I just want to say that it depends on the biology of the tumor. It depends on when patient has come to you, which stage it has come, and what is the complete treatment, whether they have received complete treatment from the point of view of surgery, radiotherapy, chemotherapy, oblique immunotherapy, and we cannot just say that all the tumors they are having similar survival, right?
Next question is from Ravi. What are the areas that have recently developed with the help of telemedicine?
Now we are working very closely on oral cancers, and with telerobotics we are trying to develop an instrument with the University of Illinois, with medical engineering department, Dr. Keshav and Rohit Bhargav. They are helping us, is to detect early cancer breast by robot and by gloves, surgical gloves, which we want to develop with nanoparticle smeared gloves, so they can almost replace mammography, and female can do herself. So there are oral cancers which we are doing, and with tele ultrasound we are able to detect liver diseases, liver cancers quite early, and pancreatic cancers quite early. So it all is again different types of tumor, different diagnosis, and with this telemedicine and IT enabled services, it has gone quite into the house of people, those who are there. Right.
Next question. What are the barriers to healthcare access in rural areas?
The first barrier which I personally feel is approach to a hospital, which is catering to, and then awareness in the patient, and then myths about various diseases, be it right from simple fever to a cancer. So I think so there is a lot of things which are happening which is to be considered as barrier in this country, apart from of course the basic logistic and transportation systems. People with delivery, people with pregnancy, people are not able to reach the setup, such is the problem. So I personally have an opinion that rural model is a very challenging model, because we have a lot of infrastructure support which is not there, and that is one of the things why people are not able, and then awareness, and then some of the programs which are not being able to kind of reach to people, and that awareness is not there. That is why we are having delayed treatment, and people either have high mortality or they have advanced diseases when they come to us.
Second question from Satish. Do you have any screening campaigns for early detection?
We do mass screening program for cancer breast. We do mass screening program for cancer cervix. That is a portion of uterus which is there, and then we do a lot of screening program for head and neck cancers. So these are all visible cancers which can be detected early, and we do have hepatitis screening program, which is a precursor for liver cancer. So hepatitis B if it is there, or hepatitis C, which can progress into cancer liver. Thus, these are the screening programs which are commonly being done, apart from other screening programs of basic diseases like tuberculosis and others.
Next question from Chetan. Is clinical genomics or genetics being practiced by the physicians in rural settings? Are they trained optimally?
Really no, Satish. I just want to say that this is where we are working very closely with genomic companies, that we can bring on some kind of affordable genomics detection program, which is now very costly. But I think so over a period of few years down the line, when things will become cheaper, and then equipments and other technology will become cheaper, so things will be cheaper per se to my end user, that is patient. But yes, I think so as a research project we are able to do something for them. But as far as awareness of patient through doctors, and doctors awareness per se themselves is not really very great in genomics as far as.
Next question from Gunpreet. What are some strategies that have been used to improve access to care in rural communities?
I think so. Basically, there are 2 or 3 prong approach which we have to follow, apart from the government's very good incentive on detection and other things on awareness. There are a lot of programs through ASHA. There are a lot of private entrepreneurs, those who are doing a lot of screening under their CSR activity, and then safe drinking water. And private institutions also are playing a very important role in their strategy now to go out, outreach and reach to the poor man's home for understanding disease. But yes, it is a very long story and a long kind of exercise, and strenuous exercise, because it requires a huge dedicated team. So I personally have an opinion that apart from doctors, paramedical college, we are able to train the younger generation kids towards better health, and that will be a great solution, which I personally see can give to a country of 130 crore population a great solution to better health care.
Next question from Preeti. What are the plus and minus of hub and spoke model in delivering care to rural areas?
I really don't see much of rural model itself is it's in a separate entity. It has a lot of intricacies, it has a lot of challenges, and it has a lot of strengths also. But what is required is a good educational program, both in doctors, both in paramedic staff, ASHA workers, and in community. I think so. That is what is going to be the future for government and private entrepreneurs also to work and look into it. And of course, IT-enabled services will make things very easy.
Next question from Dipanshu. What type of healthcare services are difficult to access in rural areas?
I think so. I discussed these things. There are a lot of things which are related to logistic. Otherwise, most of the healthcare services are available at district hospital levels, but it all depends that how and when they are referred to a district hospital level or to a institute like ours. But now people are aware, people go with brand, people go with big names, people go with and with the mobile which has become very popular among rural population, everybody can approach their doctor whom they have confidence in within a few seconds. So with IT enabled video conferencing, Skyping, and other facilities, it will become very easy. And I see it because most of my patients now are sending their photographs of some ulcer in the foot or swelling in the foot. So it becomes very easy. They are asking doctor that shall I come early? So it has become very easy now.
Next question from Abhay. How does the lack of healthcare access affect population health and patient well-being in a community?
Can you repeat the question?
Yes.
Hello.
Next question from Abhay. The question is from Abhay. How does the lack of healthcare access affect population health and patient well-being in a community?
I think it's very simple. If you are not healthy, your body is not healthy, you will definitely affect the community by virtue of a ill health community, or a non-healthy community will definitely not perform as what it is desired to be. A sick person with a sick body cannot be a good thinker. So I personally feel that healthy body is required for whether it is community or rural community or any other community. You require to be fit.
Second question from Chetan. Can you give 2-3 examples of lab to bedside, that is, research in clinical genomics translating into actual clinical interventions or management?
I think so. A lot of examples have come, like BRCA1, BRCA2, which shot into fame by Angelina Jolie, who got her breast surgery removed. Breast surgery done, and then got her normal breast removed, because her mother and sister suffered from CA breast, and she had genomic indicator that she has a trend for developing breast cancer. Similarly, some of the genomic model, like identifying a particular gene in diabetes type 2 or young onset diabetes, and thus probably offering a treatment which is entirely different from what is being done. So for lung cancer, like some of the genomic work which has been done, which is indicating that one particular medicine may be more effective. So there is a role for effective treatment, there is a role for rethinking of traditional way of looking to medical science with the advancements in genomic sciences. So I personally have an opinion that this science will go a long way.
Next question from Satish. Are you doing anything immunotherapy in cancer care?
We do give immunotherapy in some of the patients, but especially for long-standing leukemias, chronic myeloid, we are intending towards immunotherapy, but their role is very, very limited, and some of the therapies are being tried in various other cancers like melanoma and all that. But yes, that is a portion which is kind of which comes under the purview of medical oncologists. I am basically a surgical oncologist, so I will not be able to highlight that part specifically.
Yes. Next question from Preeti. Which are the organizations working in improving rural healthcare access?
And there are a lot of we from Birla Group, MP Birla Group, we are working very big way into rural health model. There are people like Tata's have been working, Reliance have been working in rural model, and Bharti in Punjab, and Dalmias have picked up in Orissa. So I can name many. Honda is doing again in Ludhiana, Munjal Group. So something or other, whether it is directly healthcare or related to healthcare, whether it is IT support, whether it is CSR activity, whether it's the safe drinking water, whether it is creating awareness, training programs. I think so somebody is doing some bit of work at their own level, whatever they feel and whatever is the and Government of India in its notification brought out last year about 2% of the net profit to be put up in CSR. People are taking up this as a kind of very serious business, and they are putting back to society.
Our last question. What are the commonly diagnosed medical problems in rural areas as compared to urban areas?
I really can't say, but yes, communicable diseases like waterborne diseases like hepatitis, whether it is drinking, parasitic diseases, diarrhea, cholera, dengue, chikungunya because of unhygienic conditions, and then of course to say that tuberculosis and other. But yes, the lifestyle diseases are also coming, like diabetes has come in a very big way. Cancer, which is also considered to be lifestyle disease, and smoking and alcoholism. So all these things have come. Now it is a mixed pattern. Earlier it was thought that rural model does not suffer from that. But now we are seeing a great extent of disease all around in all the corners of India, and specifically waterborne diseases and communicable diseases are very, very common. It is not lucky we could eradicate polio, but to become malaria free like Sri Lanka, it will take some time. I think so. Sanitation and then awareness and people, Swachhata Abhiyan of Prime Minister Modi. It'll go a long way if people start worrying about their surrounding, if they start worrying about not littering and keeping their place clean and the country clean will definitely reduce. And then safe drinking water, good hygienic, like to wash hands before using, and then giving 6 months. As you can see, there are a lot of things coming up in television from Ministry of Health on to giving feeds, breastfeeds for young females. So I think so. All this important role in decreasing disease pattern in rural model. Thank you.